Newton technology provides patient-specific, full-range soft tissue-based planning without the need for additional imaging or capital cost. To begin, GPS is placed in the surgical field for easy access. Use pins to secure the active trackers on both the femur and tibia. Map the patient's mechanical axis and articular surfaces. Preoperative range of motion, kinematics, and initial joint laxities are assessed. With the adjustable module clipped into place, review the patient's specific tibia plan. Adjust the position of the module in preparation for the tibia cut. Once the lines turn green, secure the tibia cutting block with pins and perform the resection of the tibia. The tibia cut is recorded and validated green for accuracy. Insert the Newton tensor into the joint. Calibrated force will be applied to the medial and lateral compartments independently. Perform the Newton acquisition to capture the full-range anatomic ligament laxity. Adjust the suggested plan based on patient alignment needs. The postoperative balance updates in real time as adjustments are made. Once the plan has been accepted, pin the distal block in place and adjust to its final position. Perform the distal resection and validate for accuracy. Following the on-screen prompts, pin the finishing guide in place and complete the femoral resections. Record the anterior resection and validate for accuracy. With the femoral trial in place, the Newton acquisition is completed and the plan versus verified balance can be assessed. Visit newtonknee.com for more information.